Hi, my name is Ali. I'm a second-year medical student at U of T, and today I'll be presenting Newcomer Health in Canada. So just a little bit of background, newcomers make up more than 2/3 of Canada's population and constitute around 20% of the population. We know that immigration is critical for Canada's economy and will be so in the future as well. The relationship, however, is reciprocal as Canada relies on newcomers for economic growth and stability. Newcomers also rely on Canada to escape humanitarian crises. This is a critical time for Canada as we see a lot of humanitarian crises all over the world, such as in Syria, Ukraine, and Palestine. And to give you some numbers, in 2021, more than 45,000 refugee applications claims were placed, more than 30,000 were accepted, and more than 50,000 were still pending at the end of the year, which shows the huge backlog in applications from refugees. So the current situation, how do newcomers access healthcare in Canada? So refugees in Canada receive healthcare through the Interim Federal Health Program, or IFHP, which is a limited temporary coverage for individuals who do not qualify for provincial healthcare. It's essentially a third-party insurance plan paid for by the Government of Canada. It applies to resettled refugees, protected persons, and victims of human trafficking. So what does it cover? It covers the essential healthcare services such as hospital visits, ambulances, pregnancy services, and some allied healthcare professionals, as well as the essential vaccines. So what are some of the shortcomings, or what are the important gaps in the program that can compound other barriers to health faced by newcomers? These include lack of interpretation services, complicated billing services, as well as lack of protected laws surrounding IFHP. In 2012, the federal government clawed back on IFHP, but however, this was reinstated in 2016. Despite the existence of IFHP, women with migrant status are also particularly more likely to be refused healthcare. Many doctors lack expertise in tropical diseases and other foreign diseases that are faced by refugees. Many healthcare professionals lack knowledge in IFHP billings, and the coverage for interpreter services in IFHP is incomplete and leaves out some newcomers' health slipping through the gaps because of language barriers. So why should we advocate for this? As Canada increases the numbers of newcomers, it needs to provide them with healthcare. Canada has committed to increasing newcomers. In 2024 alone. They want to bring in more than 450,000 newcomers. Yet the Immigration and Refugee Protection Act does not specify a language that guarantees healthcare services for newcomers, which will have the impact of increasing the strains on the limited number of healthcare providers that specialize in healthcare for newcomers. So why should we advocate for this? And basically, we're trying to see how are newcomers' health uniquely influenced. So we know that newcomers face disproportionate number of factors that impact their health, such as low socioeconomic status, low income, as well as low education. Asylum seekers are more likely to face PTSD. Newcomers have a higher likelihood of infectious diseases, cancer, diabetes, and many of them face systematic barriers to healthcare. So is this something that the federal government cares about? Well, the government of Canada recently reaffirmed its commitment not only to resettling refugees, but also to provide them with basic needs. This is therefore a relevant topic for the federal government and a reasonable ask. The federal government also is responsible for the intake of immigrant and refugees, and this is done through funding to MEDA via Blue Cross, which is basically the third-party insurance company. Is this something that medical students care about? Well, the Gateway Newcomer Project at Dalhousie and Memorial Universities provide medical students with training to be able to provide compassionate care for healthcomers or for newcomers. The CFMS has outlined its position surrounding immigration, refugees, and asylum seekers through two published position papers in 2013 and in 2018. And this topic was actually shortlisted for last year's NDoA, but was not selected because decriminalization of opiates was on the political agenda. So these are some of the potential asks. We want to ensure culturally appropriate and competent healthcare centers exist by mandating them in the Canada Health Act. So mandatory, provincially funded interpreter services for all healthcare clinics and services, as well as recognition that refugees and newcomers eligible for IFHP fundings are not denied care. And this can be done through being enforced in the CHA as a requirement for provinces to receive Canada Health Transfer payments, which is the payment the federal government sends provinces if they meet certain requirements. A second ask would be to create stronger protection for IFHP coverage for newcomers to prevent cutbacks that happened in 2012. And this can be through integrating IFHP into the Canada Health Act. Another ask is to eliminate the 3 months waiting period in Ontario, Quebec, and BC, and other provinces as newcomers transition to landed immigrants. And we want to streamline the IFHP process to make it more accessible for practitioners who may avoid caring for newcomers because of obstacles in receiving remuneration. And this can be done through education at provincial level, through national education campaign, and streamlining the IFHP program. And finally, we want to extend coverage for IFHP and make sure there's comprehensive interpretive services coverage. These are some of the potential organizations to consult in Nova Scotia, BC, Ontario, Ottawa, as well as Saskatoon. And these are just the final words and potential considerations. This is a highly relevant topic, as noted by the ongoing situation in Syria, Palestine, and Ukraine. Canada has a continued ethical responsibility for newcomers, refugees, and asylum seekers. The government has previously demonstrated the ability to cut back on IFHP, and they demonstrated a lack of protection for IFHP. Newcomers are a fundamental part of our society, country, medical system, and medical education system. And as future healthcare professionals in Canada, we have an obligation to advocate for patients, especially the most vulnerable, particularly refugees and newcomers. Thank you for listening to my talk, and these are my references.